Hi, my name is Ben Musselman, and we're going to be doing some ultrasound on Greg here. He's got acute lateral epicondylitis. So if you're going to come over here, we're going to set up the machine for some ultrasound. So you're going to hit ultrasound, you hit the button over here. Then if the parameters aren't what you want, you're going to hit edit. So since we're doing lateral epicondylitis, that's superficial, so we're going to do 3.3 megahertz for frequency. Duty cycle, since it's acute, we're going to go to pulsed, and we're going to go to 50%. Display, just leave that how it is. Treatment time, we're going to do 5 minutes. That's the minimum of treatment time for ultrasound you're going to do. And then for intensity, we're going to start at 0.5. You can start at 0.5, then you can move all the way up to 0.1, depending on how the patient feels and how it's affecting them. So we're going to find over here, find the lateral epicondyle. So it's right there. I'm going to make a little mark. So we can just make sure we know where we're doing it. And if the patient had long sleeves or something, you would want to roll them up and then drape them with a towel or something just to make sure it doesn't get on their clothes. Actually, I'm going to put this under your elbow just so it doesn't get on the table. So we're going to come over here. We're going to take the cap off the machine, and then we're going to clean it with a alcohol prep pad just to make sure, because you want to do this so if they have a cut or something, nothing that's on the head gets in the cut to get an infection. So you're going to then want to take some gel, put it on the area. A little more, that's good. So, and then you're going to want to maybe rub that down around a little just to make the air you're going to get. And then you're going to want to hit start. So like I said, we're doing the 3.3 frequency because it's a superficial. Then I said the pulse rate, we're doing it 50% because it is acute, so you don't want to increase the inflammation by getting a thermal effect. Because if you do it 100% or continuous, you'll get some heat, and then that'll increase vasodilation, increasing blood flow, which increase the swelling or the edema in that area. So that's why you do pulse, so you don't get that thermal effect. And then intensity, like I said earlier, start at 0.5. Then depending on what you feel as a therapist is right and the patient, you can move between 0.5 and 1. So you want to move in small circles and you want to move small circles in the area. You can go up to 4 times the EDA. ERA, my bad. That's okay. ERA, which is the head of the crystal.
Must be a novice therapist.
So you can do up to the 4 times that. You don't have to do that big. You can do a much smaller area. You can do like just the size of it, or you can do 2 of it. Yeah, and that's pretty much the parameters of what you're going to follow. So we're doing this for 5 minutes. Like I said, that's the minimum you're going to do this for. You can do it. It depends on different books say different things. Like some books say for each square or head of it, you can do 5. You should do 5 minutes. So that would be up to like 20 minutes, but that's a long time. So I'm just going to do 5 minutes because that's the minimum. And then it's good to talk to the patient and keep them interacted, just because it's kind of a long process and can get boring. You want to keep the head of the ultrasound perpendicular to the skin or the surface, because if you're going like an angle, it'll reflect and not get the same effect. So you want to make sure as you're going over different surfaces that you keep it perpendicular to the skin. And you want to make sure you and the patient both have good posture so you don't, I guess, hurt anything. So as I'm trying to sit up straight since I don't have a back to this chair. And you want to keep moving while you're doing this, so because especially if you're over bony structures, because if you don't, you can burn the patient and get a lawsuit. So you don't want that to happen. And the lateral epicondyle is where many of the extensors attach of the hand and the forearm. So that's kind of the tendons and muscles that we're, I guess, targeting.
It's also known as
tennis elbow. If you play a lot of tennis, golf, a lot of high velocity sports that require that extension.
Well, golf it's medial epicondylitis.
Well, it depends on how you hold your swing.
It's true.
So it all depends, just like our slogan here in physical therapy.
But we're just two laymen. What do we know?
Can you stop moving, please?
It's my educated laugh.
You're educated?
Yeah,
Okay, so now since it's off, it turned off automatically on its own, so you can wipe up the patient, wipe the gel off, make sure you get it all off, and then clean the head, get the gel off, and then you want to clean it with the alcohol wipe just in case the next therapist forgets to clean it. So we're done.